Hello, good evening. We're still live on the Big Bulletin. Welcome to Asaase Business PM. My name is Emmanuel Aboagye-Wiafe, and I'm here with my co-hosts,
Rosemary, Balami.
Our guests, Desmond C Appiah, Country Lead at Clean Air Fund, and Raphael Osei Boakye, Senior Meteorologist at the Kotoka International Airport Met Office. PM is proudly brought to you kind courtesy Enterprise Insurance. This year's Enterprise Motor Insurance promo dear, a year different. Obia dear womu. Simply buy or renew your motor insurance with Enterprise and win instant gifts such as fuel coupons, branded gift items, and qualify for the monthly raffle draws with amazing rewards. What's more, when you buy your motor insurance from Enterprise, you stand the chance of winning an iPhone 14, washing machine, high-pressure car washer, vacuum cleaner, auto tire inflator, and in the final month, a premium Crush Rocket motorbike. Get free fuel coupons and be the possible winner of these amazing rewards at our monthly raffle draws from January to June. This promo is regulated by the National Lottery Authority and on the Caritas Lottery platform. Terms and conditions apply. Enterprise, your advantage. Business PM is also brought to you in partnership with the Center for Sustainable Transformation. This is the SDG-Hub, where we discuss challenges, opportunities, practical and business approaches to implementation of the Sustainable Development Goals, commonly known as the SDGs. These are goals, 17 of them, 169 targets, which are developed by UN member states to make the world a more just, equitable, greener, and peaceful place. Well, like I mentioned earlier, I'm here with Rosemary, Balami, and she's from Young Reporters for Environment, YRE, at the Center for Sustainable Transformation. Rosemary, good evening and welcome again.
Good evening. Thank you.
Well, so last week we had a very interesting conversation about fast fashion and the future of sustainable fashion here in Ghana. We also talked about how individuals and stakeholders can play a role in finding solutions and meaningful contributions towards a sustainable fashion industry. Well, this week we're going to look at a very sensitive issue in the wake of Ghana's capital, Accra, which is set to be topping the list of cities with the highest air pollution in the world. Amazing, isn't it?
It's shocking.
It also came as a shock to me, especially to many Ghanaians as well, with the EPA cautioning citizens to start wearing nose masks due to the current low quality of air.
Absolutely. Well, for some of us who have been working in the environment for some time and have been concerned about the environment, it's actually not really shocking because we as young reporters for the environment, that's what we do together with other NGOs. We make sure that we create awareness on these environmental problems, including the consequences of air pollution. So according to Clean Air Fund in Accra, approximately 3,000 premature deaths, roughly 11% of the total, were attributable to air pollution in 2019. This exceeds the number of premature deaths caused by malaria, tuberculosis, and HIV/AIDS. Maybe the acute situation we are experiencing now can shake us all up for more pragmatic, steps to solve the problem.
Well, indeed, it's quite very worrying, like we have been saying. And according to the UN Environment Program, UNEP, air pollution is responsible for approximately 7 million deaths around the world, with about 600,000 recorded cases in Africa. Now, this shows the devastating effects of air pollution worldwide. In fact, air pollution is the biggest environmental health risk of our time. Airborne pollutants are responsible for about 1/3 of deaths from stroke, chronic respiratory diseases, and lung cancer, as well as 1/4 of deaths from heart attack. Well, the latest air quality report from Ghana indicates that Accra, the capital city, has the highest air pollution rate in the world, and this is according to the U.S. Air Quality Index. As much as climate change is an underlying cause for air pollution locally, a lot of other factors account for it. They include road transport, burning of wastes and charcoal, and soil dust, which is killing thousands of people in Ghana every year. Figures from the World Health Organization have revealed all these statistics. So this week, we'll take a look at the air pollution and its causes, consequences, and the way forward to tackle this problem. Well, with us here tonight in the studio are prominent guests who will be speaking to the issue of air pollution and what the future looks like for Ghana. Let me introduce them at this time. They are Desmond Appiah, Country Lead at Clean Air Fund, and Raphael Osei Boakye. He is a senior meteorologist at the Kotoka International Airport Meteorology Office. He's also with the Ghana Meteorological Agency. This word is quite a mouthful, meteorologist. Well, gentlemen, good evening and welcome to SDG-Hub.
Thank you very much.
It's good to have you in our studios. Could you tell us briefly about what your job, contains, or what do you do?
Well, Clean Air Fund is a philanthropic organization which is based in the UK, but our primary responsibility or our goal is that we want to promote clean air for all. And I have to emphasize for all because there are different segments of the society. People are exposed differently. People are also vulnerable in different ways. And so we are very particular about the for all aspect because it helps us to focus on ensuring that it's not just a segment of the society that gets access to clean air, but everybody.
But is clean air really a reality? Do we have a situation where we have clean air? Because it's not everything that we can see. You can breathe, but maybe you don't know there are toxic materials within the air you breathe in.
Yes, they are. That's why we say that poor air quality is a silent killer because you cannot see the air that you're breathing. In most cases, there are cases where you can actually see the air that you're breathing. Yeah. But we are also conscious that there is clean air because if you measure the quality of air, you can't be able to tell whether it's clean or not clean.
All right. Yeah. Let me also go to Raphael. Raphael, what do you do as a meteo person?
Thank you very much. Ghana Meteorological Agency is the government institution mainly in charge of providing meteorological services. That's in the layman's point of view, you say weather information, yes, for the entire country. Okay. We also provide services to other institutions that we sort of meet their request that they give to us.
So certainly not the aviation industry alone.
Not at all. We give to aviation. We give also marine weather to the onshore and offshore, the rig oils and all those.
Wow,
yes,
interesting.
As well as providing agro-meteorological information for farmers.
Okay.
And also climate research.
All right.
Yes.
That's very well. So let's begin. And I want to start with you again, Desmond. Now, when we say air pollution, what exactly are we talking about?
Well, pollution is the introduction or the presence of harmful substances in the air. And we emphasize harmful because there are some substances that if they are in the air and you breathe, it exposes you to diseases. And you mentioned a lot of the statistics. And I think we have to upgrade one of them. Right now, Africa in last year recorded 1.1 million deaths from air pollution related.
Alone.
Wow.
Yes. And so it is becoming more prominent, and that is the highest figure behind HIV/AIDS. And so it is not a very simple issue. In Ghana, according to WHO, there are about 28,000 deaths that are recorded each year. And economically, the World Bank has also reported that air pollution is costing the economy of Ghana $2.5 billion a year. Wow. And so if we put it in context, having substances that are harmful or poisonous to us as humans and also to animals and even plants, it has so much costs and consequence.
So it's certainly not only a health issue, but an economic issue as well.
It is an extremely big economic issue. It's a developmental issue, and that is the context that we think we need to begin to put it in.
All right.
Not just the climate issues. So there are climate implications, there are health implications, and there are certainly economic implications.
Okay. So in the Ghanaian context, what are the main contributory factors to this air pollution business?
There are many. There are many causes of poor quality of air. You mentioned earlier on about road and dust. Yeah. Most of our roads are not paved, and most of our open spaces are also not grassed or not greened. And so whenever we have air blowing, it also has a lot of particulate matter that goes up, and it gets to the point where we can breathe them. There's also a lot of pollutants that are coming from natural causes, like what we've been experiencing recently, which has made everybody become aware. And those of us in this field are excited because it's building.
We were excited.
Yes, it's building the awareness that we need to build. because it's so difficult for people to appreciate that we even have a challenge like that. So there are the natural seasonal variations and the seasonal causes. Then also there's transportation is becoming, and I say becoming because there are other sources which are more prominent now, but transportation is slowly but surely becoming the big source of pollution. Cooking, the energy that we use in cooking, charcoal, other unclean energy that we use in cooking is also a major source of pollution. Waste burning is another big one in our context here in Ghana and Africa. Burning of waste is also a big one. Also, lack of maintenance of vehicles. So it's not just a matter of the soot coming from the vehicles, but even machinery and also industry. Industry is also another major source of pollution.
Now, in our part of the world, I mean, in Ghana, you could hear some people say that, we've lived with dusts, for all these years. And in some parlance, they say, a female hoarding. I've heard this on several occasions. So it looks like people don't really bother about the air pollution. How serious is this to your efforts to actually educate people on this menace?
Well, our goal is not just the education. Our goal is also to get policy initiatives and real action to address the consequence. And in Ghana, there's a lot of work that EPA has been doing in terms of measuring. And one of the things that going by the proverb that you just gave, that I think previously there was not a lot of measurement that was being done. So it was easy for people to think that there's no consequence. But now that there's a lot of opportunity to measure, there's opportunity to even know what is in the air. So, and the composition of what is in the air, I think it's easier. We are also seeing that non-communicable diseases are also going up. In elderly, women and children are even more vulnerable. We are seeing all these things going up. And so we are recognizing that as the quality of the air that we are breathing in our cities especially, in our home villages, as they burn to prepare the land for farming, all those create pollution. And we now there's enough scientific knowledge to show that there's a consequence.
It really exists.
It does exist, and we need to be able to do some things about it.
Wow.
Air pollution is indeed a silent killer.
It is.
So now, Raphael, let me come to you. So being with the Ghana Meteorological Agency, is a picture being painted a true reflection of the extent of this air pollution? Some say it's normal dust. For some time I've been seeing a change in the weather and all that. Can you take us through this, please?
Yes. Before I think 15th of February, we saw that wasn't much talked about with regards to the quality of air, though there were underground works by Desmond and his institution. From 15th of February, that we realized that there was dust rising in the atmosphere over places like Chad, Niger. These are countries on the Sahara Desert. And these are our source regions for dust for the Harmattan season, especially November, December, January.
Okay.
But this came as a surprise, not a surprise to us meteorologists, but a surprise to the ordinary Ghanaian, that we are exiting Harmattan. So how come we have another burst? We have the burst in actually 4 or 5. Sometimes we have 4. The first one will come in November, and then middle November, the second one will come. The third one will also come early December. And then late December, one will also come, which will carry us through January.
Okay.
This one, there was also the fourth burst did not come early, which we had just some few weeks ago.
Yeah.
It came as a surprise, as I said, because we know we have exited the Harmattan. But we have anthropogenic or the human-induced causes, just as Desmond mentioned. And this one that I'm talking about is the natural cause. And the natural cause, we don't have much control. But the artificial causes or the man-made human-induced causes, that's what he said. There needs to be pragmatic efforts to curb these causes. Yeah.
Absolutely.
Well, we want to know more about what air pollutants do to our organs, our health in general. But before we continue the conversation, let's hear from our healthcare professional, Dr. Nana Safo Jesiado, regarding the health implications of air pollution.
So what are the health implications of air pollution? Air pollution has several health implications for the individual and for the population at large. In the short term, air pollution can lead to conditions that make it difficult for one to breathe. So we are looking at lower respiratory tract conditions like acute bronchitis, like bronchiolitis, and even the onset of asthma symptoms in patients that are suffering from the disease. Additionally, you can have irritation of the skin, atopic dermatitis, eczema, and even irritation of the eye. These are all some of the short-term effects of air pollution. In the long term, and in fact, the bulk of the impact of air pollution is long-term, such that the damage is not immediately noticeable, but you give it an ample amount of time and then you find that it has a link to conditions like chronic obstructive lung disease, even lung cancer, ischemic heart disease, and even stroke. All these conditions have been found to have a strong link to air pollution. I should also mention that COVID-19 is still in the system, and air pollution, or people who are affected by air pollution, have been found to be more likely to suffer from severe disease or to even die from complications of COVID-19. So let's keep that in mind. I should advise people living in Accra, seeing that Accra is very industrialized and rapidly urbanizing. So because of that, we have a lot of pollution in Accra, I should say. Industrial emissions, vehicular exhaust emissions in Accra are very, very common and rampant. I should advise that we should consider using public measures of transportation or public means of transportation as much as possible, when we can, so that we can reduce the amount of exhaust emissions, vehicular exhaust emissions that are in the system. Let's also use proper cars so that our engines will be working properly, so that they can also affect the quality of the air, the quality of the fumes that are produced by the cars, and by extension, the quality of the air. We can carpool as much as possible to get to, if we are going to similar locations, we don't all have to use our vehicles. We can go together as one. Let's reduce also the amount of open burning of waste, where we just gather waste and then burn it outside in the open. It can also worsen the amount of air pollution. Let's keep general hygiene practices, just dusting the environment, making sure that we avoid pollution in our immediate environment. Keeping it clean can also help to reduce the amount of pollution that we are exposed to in our immediate environment. Generally, let's encourage a healthy lifestyle, diet, good food, exercise, keeping active. These are all measures that can help to boost our immunity and to help us to not suffer some of the effects, the negative effects of air pollution, as we continue on a national level to explore new and sustainable ways by which we can generate affordable forms of clean energy for all of us to be able to use.
JC Ado has spelled it all out. We need to be very careful with our lives and, of course, lead air pollution-free lives.
Indeed. Our health is very important, so we need to take these measures very seriously as a country and as a people. So, Raphael, back to you. When did we start collecting data on air pollution? And is what we are seeing now extraordinary, or we had the same level of air polluted, in the past?
Well, Ghana Meteorological Agency has not actually been in the picture, with regards to collecting air quality data.
Okay.
Yes, just recently that we have started collaborating with the Environmental Protection Agency on certain projects to collect some data, but they are actually in full force doing it, just that we are collaborating with them. So what happened just recently, as I said, was a natural event which occurred with the dust being carried from the Sahara Desert to our sub-region. But with the anthropogenic ones or the human-induced ones, that's what we need to take pragmatic actions.
Now, this one is interesting. Was somebody exposed to sweet fragrances for a long time also be air pollution? Because it depends on, I believe it depends on what you are smelling. That's,
Exactly.
Yes.
Makes it air pollutant or not.
Yes, I'll answer that quickly. But EPA has been collecting air quality data in Accra since 2006. They've been doing some monitoring. And there are a lot of initiatives like taking lead out of our fuels and sulfur and all those things were initiatives that were informed by this kind of decisions.
Okay.
So, I think the natural air is not about having sweet fragrances. And so over time, you will see, even if you work in an environment where you say, oh, this is a sweet scent, over time you lose some of your senses. Some people even lose their taste because of what they are exposed to. And so it is, don't let us not get carried away, unless these scents are coming from flowers and the like.
Those are natural.
Yes. Now, even that, there are people who are sensitive to those. And so it may be a trigger for, say, someone with asthma. And also, so we have to be conscious of that.
All right. Now, when we go outside, we see an increase of people wearing nose masks again. Quite uncomfortable, especially because we've left the extreme COVID cases period. Now, aside from wearing of nose masks, what other role should individual citizens play to protect themselves?
Well, I think there are many things that individual citizens can do. And if you permit me, I'll also look at what state institutions also ought to be doing. But the individual citizens being conscious. In fact, as I mentioned, we are excited that EPA has now started making public some warning, some indicative signs of the state of the air, so that people who are vulnerable may know how to behave. They may know whether they should go out at this time or wait till later in the day, because they have now regulatory grade monitors at the University of Ghana, the American Embassy, and at Accra. These are continuous grade monitoring that is going on. So sharing that information helps us. It makes us become aware whether we should take the nose mask, whether we shouldn't go out at the time that we had planned to go out. So these are immediate steps. And the good thing about air pollution is that when you take steps, you see the impacts immediately. If we reduce burning or you eliminate burning of waste, you would see it. So individuals can change their waste management habits by not burning the waste. If you service your vehicles, and so the vehicles are not polluting as much, you can immediately feel the difference in the quality of the air. Also, when the doctor mentioned about even the kind of foods that we eat, if we become conscious of what we are eating, which triggers us, we need to be able to pay attention and to do something about it. And then on transportation, the kinds of transport that we use is also very, very crucial, because as I mentioned, pollution from transportation is going up. And so I think these are things that individuals can do. But from a national or governmental point of view, undertaking major greening initiatives are very helpful. What are the development choices like transportation? Are we building just roads, or we are putting other forms of public transport in the mix? That is also extremely important. And then we know that the economic impact, lost time from work, people not going to work just because they are not feeling well. These are all some of the things that can be done from a national angle, because it saves us money and helps to improve the climate and also the quality of air.
Oh, interesting.
Yeah. So, we know that you have been doing some training with some representatives of local assemblies in Accra. So can you tell us a bit about that and what are the expected outcomes?
All right. So Clean Air Fund has, with support from EPA and 15 local assemblies in Accra, launched a data component of what we call Breathe Accra. And then the aim of that is to equip the local assemblies that are part of this project with capacity in terms of interpretation of data. We are going to augment EPA's sensors that they have with another 50 plus sensors, because we really need to have a dense network so that it's easy for people to go online, look at the state of quality of air in their area. So we are also equipping the environmental health departments of the assemblies to understand that they have the responsibility for enforcing or supporting EPA to enforce the laws. If they do not understand it, it will become difficult for them to enforce. And that is part of what we are doing. There are other programs that Clean Air Fund is going to roll out this year to build demand for clean air.
I guess, before we wrap up, just some quick tidbits to safeguard ourselves against air pollution and things like that.
Okay, so just as Doctor mentioned, the hygiene protocols need to be followed religiously. And as we enter into the rainy season, we also expect other diseases, not just only by air pollution. With regards to our choked gutters and other things, we expect that the ordinary citizen will also have to ensure that these things are followed well. So just as the doctor said, we have to follow these hygiene protocols.
Okay, all right. Desmond?
Yeah, I think we would have to create the demand. There is no demand. It's only this past few days when we saw that people become conscious.
The reports that came.
Yes, but we have to have a demand for it. Because if we demand it, then I believe that policymakers and leaders would also take the actions that are necessary to help us to improve the quality of air. Because all of us, everybody is exposed.
Absolutely. Thank you for sharing your expertise and insight on this conversation. Now, if you're a listener between the ages of 11 and 25 and get inspired to write, make a video, or take photographs of issues relating to environmental problems and solutions, or know someone who does, the YRE has its annual competition out now. Visit our website at cestint.com/YRE competition for further details. Grab this opportunity to give the environment a voice. Who knows, you could be our next lucky winner. So tune in same time next week as we continue discussions on all things sustainable development right here on Asaase Radio 99.5 so that people and planet can prosper.
And thank you so much for staying with us on the SDG-Hub. We've been speaking with Desmond Appiah. He's the country lead at Clean Air Fund, and also Raphael Osei Boakye, senior meteorologist at the Kotoka International Airport Met Office. I've been your host, Emmanuel Aboagye-Wiafe, and I've been doing this with my
Rosemary Balami,
regular co-hosts.